Hi, my name is Jimmy Dino. I'll be going over utilization review and safety and quality. For utilization review, the primary goal sought out by utilization manager for EH's case is to be discharged home using two items: the home use of supplemental oxygen and the request of a CPAP or BiPAP machine for the use of hours of sleep. The medical equipment requested from the insurance is deemed a medical necessity, and the appropriateness of level care of the patient receiving can be continued at home, ensuring a continuation of care of her treatment. In order to prevent readmission to the hospital, both equipment must be present at the house. So that way it can prevent readmission to the hospital, which in turn will cause increased burden on the family and a greater workload for hospital staff, as it may worsen her condition that may eventually, when it comes to multiple patients coming back to the hospital, lead to RN burnout or higher employee turnover. The result in medical approval, the delay causes discharge from the hospital to be delayed by 2 days, requiring extra resources from the hospital that are not necessarily needed for her stay in the hospital, thus taking resources away from other patients who may need these resources. Quality and safety issues. Reinforcement of discharge teaching to the family. Accurate assessment of discharge needs dependent on the knowledge of the disease process and treatment and regimens. Knowing the importance of each intervention will help reinforce the family of why each intervention is done at home. Why do we put her on oxygen? Why is she placed in the BiPAP machine? Why do you need to assist her with a gait belt while getting up, using the bathroom, or transferring her? One of another safety issue is the risk for falls related to EH's CO2 retention and weakness. Now, if she's weak, the use of a gait belt may be appropriate to assist her to get up. Also, this may be used to help her with a controlled descent to the floor if she were to lose the strength to stand up. Poor oxygen perfusion is as manifested by, or as evidenced by admission to the hospital as CO2 retention. The requirement to use a CPAP at home during hours of sleep is something that can be ensured that she doesn't retain CO2, that she doesn't have apneic periods or asphyxiation. However, the improper placement of the apparatus that attaches to the CPAP or BiPAP machine can lead to those increased periods of apnea and asphyxiation. Role caregiver strain. Now, her sisters assume care of EH on a daily basis for 24 hours a day, both sisters. Now, this can lead to financial difficulties, as this may lead to gaps in her care where one sister or both sisters may look for secondary jobs to supplement their own financial income, where it will leave EH unsupervised, thus leading to possible bodily injury due to trips or falls. The necessity for a 24-hour caregiver is needed